Hello and welcome to RSNA 2014. My name is Brian Casey. I'm editor-in-chief of AntMini.com. We have with us today Dr. Cynthia Sherry. She is Chief Medical Officer of the American College of Radiology's Radiology Leadership Institute. Dr. Sherry, thanks for being with us today.
Hi, Brian. Thank you. Good morning. It's a great pleasure to be here.
So one of the things that has been a very common theme at this meeting and also at the last couple of meetings is the need for radiology to change, for the specialty to change to adapt to a changing healthcare environment. What sort of things are you seeing here at RSNA and in general in radiology?
Well, change is definitely on the horizon in medicine in general and radiology in particular. We're seeing unprecedented changes and trends toward bundled care, episodes of care, accountable care organizations, and population health. So radiology will play a role in all of these things, and the big question is, when are they going to assert themselves, and when they do, what are they going to do? How are they going to become influential?
So what are some of the roles, the changing roles of radiologists? What are some things that the ACR is trying to push radiologists into doing differently? There's the Radiology 3.0 or Imaging 3.0 initiative, some other things as well.
Yes, Radiology 3.0 is definitely making some inroads, and the Radiology Leadership Institute was created to help radiologists make the transition toward taking more of a leadership role. Radiologists in general tend to stay in their reading rooms producing reports, and they're not out in the world enough. They need to learn a little bit more about how radiology as a central component of modern healthcare can take that appropriate place and help steer some of the decisions and policies that are coming down in healthcare right now.
What are some of the concrete things with the Radiology Leadership Institute that you're doing to try to affect that change? How does it work?
Well, doctors, including radiologists, are leaders naturally. They just because they have the title of doctor, they are leaders. But they aren't trained in that. It's not part of medical school curriculum. It's not part of the residency or fellowship training. And so the Radiology Leadership Institute is helping them to learn more about practice management and leadership in general, and then giving them the opportunity to practice those things because they're behavioral competencies. And without practicing them, you can't get good at it. It's kind of like a golf swing. You can read about it all you want to, but until you actually get out there and swing the club, you don't know how.
Yeah. Now, how does the Institute work? Is this something where radiologists can do this at home at their own pace, or do they physically go to another location to train for this kind of thing?
That's a really good question. And when we were designing this program, we wanted it to fit for everybody, not just the chosen few who raised to department chair or practice president, but for every radiologist. So we decided to create a blended approach so that radiologists can take courses at night when it's convenient to them, on their days off. They can do that on the internet with live webinars or even pre-recorded webinars. We're also doing a host of live events, and we're doing those oftentimes in conjunction with prestigious business schools like Kellogg and Babson. And we also have some cohort programs in conjunction with Harvard Business Publishing, so that they can go into a modular program that lasts 3 months, and each of the 3 months is dedicated to a different topic. And so they're with the same people each month along the way, and they learn from each other, and they analyze cases, and they learn a lot about management and leadership that way.
Now, is the RLI something that you see mostly for heads of practices and departments, or is it something that even lower level people can get into?
Everyone can get into it. There are so many opportunities out there for physicians and radiologists, radiology professionals in general, to make a difference. They can be heads of hospital committees. They can take a role in their practice in advancing that. They can get involved in local politics. They can become involved in the hospital administration or hospital system management. So there are so many different ways for radiologists to make a difference. And we're going to just help them get up onto the learning curve so that they can be influential.
Now, do you think that the message that organized radiology has been trying to get out to radiologists that you've got to get out of the reading rooms. Is that having an impact, or are we seeing some resistance to that?
I think we're seeing a gradual movement away from the traditional fee-for-service volume mentality toward more of value. And that's a real hard jump to make because right now, most of the reimbursement is on a fee-for-service basis, and it might stay that way for a long time for radiologists. But we have to be prepared to make the jump when the time is right. And so that means you have to have a dual strategy for coping with the changes and figuring out the right time to make the jump.
Good. Well, it certainly seems like it's having a big impact.
Yes, it's been challenging but fun.
And then you've had changes in your own job that have kind of reflected the changing landscape.
Yes, that's true. It's a little bit of a push and a little bit of a pull, but I decided to leave the practice of radiology, and I have joined Texas Health Resources, which is a large multi-hospital system in the North Texas region, and I'm in their Center for Population Health Research and Education, and I'm the Chief Medical Education Officer.
Okay, great, good. All right, well, leading by example then, I guess.
Yes, that's true.
Well, thank you for being with us today.
It was a pleasure. Thank you.
All right, signing off for AntMini.com, my name is Brian Casey.